So the latest studies that we know about were done with the American Society of Aesthetic Plastic Surgery. Very reputable surgeons came up with a smart initial study to try and start evaluating these things, and they took blood samples from a control group, which was women that just underwent a breast lift with no implants. They took blood samples from women with implants with no symptoms, and I've had them, I assume, for a while. And then blood tests from women with the breast implant illness, or again, the systemic symptoms with breast implants. And they tested them for heavy metals, because the theory may be that some heavy metals are leaving the implant and entering the bloodstream or the body and causing all these symptoms to occur. And for now, with this study, although it was a small group, the levels were tested were below the FDA recommended levels for heavy metals. They also went further and they took tests of the scar tissue, what we call the capsule that forms around the breast implant. Some women get that capsule becomes hard. We call it a capsule contracture. And they tested the scar tissue similarly between women that have the implants with no symptoms and probably had the capsule removed, maybe due to a capsule contracture, and obviously the women with the systemic symptoms with breast implant. And they tested the capsules for the heavy metal levels, and again, both were below the recommended level. So the theory of the heavy metals, even though we have to get some more numbers, obviously bigger studies with better control, so far have not panned out to be the case. And so there have been some recommendations regarding that, and the Aesthetic Society of the Plastic Surgeons has not recommended per se to remove the scar tissue if you are getting an explant because of these findings. Now, obviously, there is an issue with that, because if you continue to support the theory and you have your implants removed and you don't get better, well, we have a bit of a situation to deal with here, because then, you haven't removed the capsule, but I believe that the theory is that there are heavy metals there, then I didn't get better because you didn't remove the capsule. Well, I talked to the patients about that, and that's really where it becomes a little challenging. Do you believe the studies? Do you not believe them? There's plenty stories of women that have had surgery. Some get better. I've heard of some that don't. So it becomes a little challenging, and we obviously need to continue investigating the situation and get more data and more information to really find out what is the cause. I have a few more things in the pipeline that I'm working on in conjunction to get some more information about those things, since I don't like to just sit around and wait for new studies and stuff. I'm actually discussing some data and information that I will probably announce in the near future about things that may be helpful in really finding out what is going on in this case with the systemic symptoms with breast implants. I hope that helps.